Some of the biggest challenges that we've seen from our clients are things that are going to happen within the next few years. We have an aging workforce with physicians. We have shortages created by the pandemic. And as these physicians and providers are moving out of the space, it's creating a lot of shortages. And so hospitals and healthcare facilities are going to have to figure out how to manage that challenge.
There's a massive shortage across the country. If you think of most hospitals are running at about 80–85% capacity, it doesn't give you the ability to flex and making sure that you have the clinicians in place to give that type of patient care. So, it's something that it's really important that we stay ahead of it and we understand the trends and that we're being strategic, how we're going about making sure that we're taking our clinicians and finding them the right homes to impact the communities that we support. Our mission at Caliber Healthcare Solutions is empower physicians and advanced practice providers with professionally satisfied and financially rewarding practice opportunities. We want to give them some flexible schedules that fit their lifestyle goals, as well as the opportunity to provide exceptional patient care. Being a provider-centric organization and putting them first, I feel sets us apart. We know that if we're going out and finding the most quality clinician in the space, that it's going to benefit the hospitals and the communities that we support long-term.
We pride ourselves on really being a provider-centric organization. And what that means to me is I want to be the front line of communication with the provider, really develop that relationship with them, hone in on their exact search criteria, their exact search parameters, where they feel comfortable, where they don't feel comfortable, and finding that ideal match for them.
Having some of those individual experiences and the feeling when you're really impacting someone and you have the relationship with someone that you're going to work extremely hard to make sure that you're generating results for that individual, that you're their agent. You're their career advocate, you're their trusted advisor.
Well, the most rewarding part of my job is understanding when a provider goes to work on that first day, they get to the bedside, and they have their first patient encounter. That truly gives me a sense of pride and satisfaction, knowing that we were able to make that possible as a team.
The most rewarding thing about working at Caliber is my ability to impact somebody else's life. By putting providers in place, ultimately it helps somebody who is sick become healthy. It gives them a better chance. And so knowing that every day when I'm picking up the phone and calling and that there's a potential to help somebody's life, it's really rewarding, and it's kind of what drives me. That's what drives me to come in every day and kind of do my best.
The most rewarding part of my job is just knowing that I'm going to be helping the hospital cover their needs, that there's not going to be a patient that's not served at the hospital that day because we were able to fill the locum tenens spot that was open. It's very rewarding, and I'm very thankful that I get to do that.
The reason I joined Caliber is because I wanted to be a part of something that was bigger than myself. I wanted to feel like every day I went home, I did something important and I helped someone else. I really think the Caliber difference is everyone truly cares. They want to make sure their providers are getting the best assignments. We want to make sure our clients are getting the best providers. And I think that we're really unique here at Caliber because everyone truly cares.
I think providers continue to work with Caliber because we really set ourselves apart with how we support our providers. We advocate for them, communicate with them, and make sure that they always know that there is someone on their side, and it really helps to make sure that they are successful in their positions and are able to provide quality care to their patients.
I think that we all have the same goal. We want to put our providers to work in positions that are the best fit for them so that they can be successful, so that we are fulfilling our clients' needs. And at the end of the day, it takes all of us to do that. It takes a lot of people, and when we all have the same focus and the same goal, it makes us successful, and it's something that we can all celebrate together.